This is Dr. Chris Robertson. Going to spend a little bit of time discussing implementation science. Why is implementation science important? Implementation science is going to impact your methodology in terms of how you plan various elements of your study. It will affect your study design. You have to take into consideration your sample, your setting, your recruitment. It impacts methodology, and you have to consider various aspects of implementation science as you plan your methodology. And obviously, implementation science impacts implementation, and it also contributes to limitations in terms of what you may encounter and have to deal with. So I've positioned the implementation science lecture to be before you actually start working on the methodology section of your proposal, so that you have an opportunity to fully understand it. Also, some of the items that you gather from your SWOT analysis, you'll begin to see some of these dynamics at play. And so it's important for you to be able to pull that data from your SWOT analysis and that information and understand how it impacts your methodology and how it may impact your implementation and what limitations you may already have based on information you've already gathered. So, what is implementation science? It's also called dissemination science or health service research. This is where you identify and implement best practice approaches. Sounds easy, but it's not. Implementation science actually looks at the methods that you use to promote integration of research findings, and it seeks to understand the behavior of healthcare providers and organizations and other key stakeholders when it comes to uptaking those particular practices, adopting those practices, and implementing those evidence-based interventions. The intent of implementation science is actually to look at and address the bottlenecks, the hiccups, the bumps in the road that impede effective implementation. And obviously, there are theories that focus on the relationships of very complex organizational dimensions. So essentially, you've got the research, you have your evidence, you have practice, and in the middle, you've got implementation. This is where you translate research and evidence into practice, and you do that through implementation science. And so some people even see implementation science itself as research translation. And so it's very, very important to tune into the components that will be shared and discussed. And obviously, this is a highlight with the expectation that you focus on your readings, which are not lengthy, for week 3. So, some key words. Understand what knowledge translation is. Understand what knowledge transfer is. Knowledge translation is reviewing, assessing, identifying, and aggregating practical and applying practical application of high quality research or evidence by stakeholders with the purpose of improving the lives and health of individuals. Sounds a lot like a DNP project. If you look at knowledge transfer, that's a systematic approach to capture, collect, and share knowledge in order for it to become explicit. Knowledge exchange, that's where you're looking at problem solving between researchers and decision makers in terms of, now you've got the research and now we've got to make a decision, but going through that mutual learning and the process of planning, producing, and disseminating and applying existing or new research and decision making. Granted, this is what a lot of you guys will do in your DNP projects, because you will be that researcher or that scientist that comes and presents this evidence. And you've got to work and collaborate with the decision makers in the organization in terms of how to apply that particular research and implement it into practice. Synthesis, that's essentially integrating your research findings on a particular topic. It's reproducible and transparent in terms of when you synthesize in your literature review, I should be able to break apart and know where you synthesize from and come to that same conclusion. Knowledge translation. This is the exchange, synthesis, and ethically sound application of knowledge in a complex system to accelerate the capture of the benefits of research. Again, improving health, strengthening and changing our healthcare system. The other definition is obviously the collaborative and systematic review, assessment, identification, aggregation, and practical implication. Knowledge transfer. I was going to say these words look familiar. So this is let me figure this out. Hold on 1 second. Okay, so we're going to keep going. Let me go back and look at these definitions. What I may end up doing is exchange synthesis. There were 7 of these. This is the correct one. This, I think, was where we started at. This slide should not be here. So I will take that slide out in what is being posted for this week. Yes, this is an extra slide. Okay. All right, so there are your definitions. And let's see if there was anything that was significantly different. No, there was just some abbreviation on that slide. Okay. Research utilization, the process by which specific knowledge, science is implemented in practice. Let me explain what research utilization, that's a term that's used not necessarily the same as, depends on how the research is utilized. DNP prepared nurses utilize the research in a different format. Consider as an FNP MSN what's done when you have to prepare a SOAP note and attach an evidence-based practice article to support your decision making with that individual patient. That is much, much different than when you are looking to implement a practice change that is going to impact the population versus something that you're doing to impact an individual patient. Implementation, obviously, is when you adopt the execution of the adoption decision, putting that innovation, the research and the evidence behind it into practice. Dissemination may be a new term. This is essentially where you disseminate. You take your findings and you tell everybody. You put it out there in various formats. You may do a journal, you may do a conference, be it a poster presentation, a podium presentation, but you get the word out. Diffusion is a different process. This is, for the most part, within the context of this lecture and this course, diffusion is when you have the innovation and you're looking to implement it throughout the organization. And so diffusion describes the process through which that particular intervention spreads out, disperses, diffuses through the organization, and is adopted and implemented. So with implementation science, as with everything else that we've discussed, there are always theories and there are always frameworks. And so when you start looking at translating evidence into practice, consider the various theoretical frameworks, because that is what will guide your practice. That is what will guide the actions that you take to translate evidence into practice. There are a number of theories, just so you know. These are just a few that may guide you to some extent. And so as you begin to get a feel and a sense for your organizations, you will have opportunity to see which one of these may fit and which one of these you may decide to use to guide your practice. Roger has a theory of diffusion of innovations. How do I take this innovation and get it to disperse and diffuse throughout the organization? And he says that there are 5 steps from innovation to actual decision. Those 5 steps include knowledge, persuasion, decision, and within decision, you've got adoption or rejection. And depending on how things go, particularly if something is adopted but then is discontinued, or if something is adopted and it is continued to be adopted, or if something is initially rejected and is continued to be rejected, hopefully nobody's going in that direction, or if something is rejected and later adopted. So you've got that decision, which has some subcategories. In any event, you also have implementation as well as confirmation, which goes back to maintenance and sustainability. But that's kind of the 5-step process from innovation to decision. The other thing that Roger talked about is how people actually, what diffusion looks like. So you have about small percentage of the population who are innovators. When they hear about whatever the intervention is, the evidence behind it, they jump on it. They're ready to go. You also have the early adopters. These are the people that tend to adopt and implement the intervention earlier than others, but not earlier than the innovators. You also have the early majority and the late majority, and then the laggards, who of course they are the last to implement whatever the practice change may be. And so it's important to understand where your organization may fall in regards to the innovation, or where your community or the system, how that innovation may diffuse through the organization, and which category people may fall in, because that may determine how they either embrace or reject the practice change that you are looking to implement. And so again, looking at implementation science, one of the other things to consider is, what approach do I take? And so Grohl and Grimshaw talked about 7 different change approaches and suggested that the approach be considered, which would then determine the implementation plan. If there's an educational approach, you need to consider motivation and allow ownership of the change process. If it is an epidemiological approach, you need to make sure that there's very sound and convincing evidence and rigorous procedures, and that the strategy must include strength and quality of the evidence. It speaks to what to do if it's a marketing approach, to adapt the message to the needs of the target group. If behavioral, to make sure that there's feedback and incentives or sanctions, and understand that you may truly need to develop an implementation plan that has multiple approaches. There's also social influence, because you've got to incorporate opinion leaders and champions and organizational approaches where you need to look at the areas of failure and opportunities for improvement, as well as coercive approaches, where you assume that controls are needed. So you need to develop laws and regulations and policies and procedures. So all of these things you have to take into consideration in terms of what should my approach be. And of course, depending on that approach, then you need to consider what type of framework or what type of implementation framework or theory, translation framework or theory do I need to consider. This is not so much something that you will formally even write on or speak on, but it needs to be given some thought so that even in class when we have discussion or in a discussion board, you're able to articulate these concepts and pull from your SWOT analysis to speak to what approach you should take and what from your SWOT analysis tells you that this may be the approach or approaches that you're looking at. Greenhall's diffusion of innovations model is actually one of my personal favorites, but I like it because it's so comprehensive and it gives you an idea of all the various elements that you need to consider when looking at implementing a practice change or a system level change. You have to look at the innovation. You start in the upper left hand corner and you have to look, is it complex? Is there risk? What is the nature of the knowledge that's required to implement this innovation? What is the relative advantage? Is there a relative advantage for the organization to implement? If so, that may be part of your approach to incorporate that, particularly if you're taking a marketing approach. Also, look at the other system antecedents for the innovation. Look at the system structure, its size, its maturity, how they manage their process. Are they centralized versus decentralized? What is their capacity for new knowledge? Are you dealing with an organization who recently went through a massive restructuring or a massive change, and they're just kind of tapped out with doing new things? But you have to consider the system. You also have to consider the system readiness. Are you dealing with tension in the environment? Are there power balances? Look at the adopter, the people and the persons in the system. What are their needs, their motivations, their values, their goals, their skills, their learning styles? These are all very, very important. In terms of assimilation, it's typically a complex nonlinear process, but is this process actually going to work in this environment? And the actual implementation process, looking at what that process may entail, what types of things need to be considered. And again, looking at when you're designing, there are a couple places in the model in the middle where it speaks to linkages between user system, resource system, or whatnot. So taking into consideration these various components, capture of user-led innovation in terms of when you're designing, and the implementation stage in terms of how you're going to be communicating and with who, and what project management support is going to be available to you. Remember, this is a system change. You don't want to put yourself in a position where you're changing an entire system independently, because that's going to take away even from interprofessional collaboration, which is expected. Looking at the socio-political climate, looking at the incentives and mandates and environmental stability. These are things that impact implementation. If I'm implementing a project, for instance, my DNP project, where there was a mandate that the organization was not meeting, and so this definitely made an impact on their readiness for the innovation. It took into consideration their needs, their motivation, their values and goals, and there was some advantage to it. And so you have to look at all of these various things and how they come together, as well as communication and influence. Think about how things move throughout the organization, formally and informally, because that is very important as you implement. So Greenhall's diffusion of innovation in human services organizations is very, very comprehensive and pulls out a lot of different things to consider. This is another model that looks at the research activity. Look at the research finding, look at the systematic reviews, the evidence of effectiveness. And once you find that evidence of effectiveness, this is where you've got to set priorities and develop implementing guidelines with professional organizations and bodies, with healthcare providers, purchasers, patients, policymakers, or whatnot. And you see how all of these things are interrelated one to the other, and how they take you back to the beginning in some regards. But there's still a process, and you have to look. Eventually, we'll talk about even the barriers, where they come up in this process, and how to manage them. Another, Glasgow and Emmons looked at how can we translate, how can we increase translation of research into practice. And again, you're hopefully beginning to see some emergent things. Let's look at the intervention characteristics. Let's look at the situation or the intended target settings. Let's look at the research design. Let's look if there are interactions among 3 other barrier types. This has to be considered, because if it costs too much, if it's difficult for staff to learn about, if it's not packaged or in a manual, and if they have other things that are more priority, and there are limited resources and time, and the research design that you put into place doesn't consider cost, it doesn't consider some of the other resources, you're not going to be as successful with implementation. And so Ottawa Model of Research, which is another implementation model. Again, you assess your barriers and support. You monitor your intervention and the degree of use or the degree of implementation, and you evaluate outcomes. So again, you see with every element, it provides various things to actually look at and consider. Knowledge to action model. Again, starting here, looking at knowledge synthesis, knowledge inquiry, tailoring your knowledge, identifying your problem, the review, which is what you would have done last semester. Now you've got to look at how do I adopt the knowledge to local context, and this goes back to planning, assessing barriers, tailoring your intervention in terms of planning, and when you actually start implementing, you'll continue to assess barriers and tailor your intervention to an extent. Monitor implementation, and then you evaluate outcomes, decide how do you sustain this, and then you may end up with another problem that you need to identify and revisit the literature on. And so again, this is another model that helps guide your implementation. You also have to consider the culture of the organization, and hopefully that you have a culture that promotes translation. In other words, you have champions, you have mentors, you have leaders, you have the technical resources available to you. Look at the organizational norms, values, and basic assumptions. What are their underlying beliefs and values? What of that beliefs and values can be transformed or must be transformed in order for change to be sustainable? What is the climate in terms of leadership styles, the communication channels? Is it clear? Is it decentralized? Is there a sense of teamwork? Are organizational goals clear, measurable, and consensual? And when you look at competing values, it's important to get a sense of what is valuable to the organization. Is this an organization that wants to focus on things that last? Do they want to focus on doing things first? Do they want to focus on doing things fast? Or do they focus on doing things right? These are, once you kind of get a sense for where their values are, it gives you some idea about where you may spend time, and it may give you some bearings on how you need to implement your project and how you may need to tailor and tweak certain elements based on their values, the values of the organization. And also, if you were to take Collaborate, for instance, and break that up into a couple pieces, these tend to be environments where you have more mentors and facilitators. If you look at the Control, these are environments where you have more monitoring and more coordination, and so on and so forth. Competing, you have more directors, producers. Create, you have more innovators and brokers. So you have to take this into consideration as you're putting things together. So of course, identify barriers prior to translation. Prioritize your barriers based on if they're modifiable, what is definitely critical, and also how to address. And consider implementation models that address barriers. Some do, some may not, but you've got to look at, I think, even here, assess barriers to knowledge use. So you want to see models that assess barriers and supports that take that into consideration. And so again, looking at your adopter characteristics, your facilitators, organizational characteristics, and characteristics, of the innovation, are these things that are going to facilitate, or are these things that are going to be barriers that you've now got to overcome? Well, here's another duplicate slide. I do apologize for the duplication. I'll make sure that it is corrected in what is posted, which is already posted, but I'll go back and revise it. So we mentioned this earlier with this particular slide, but looking at the barriers of dissemination: cost, time, demand. What expertise do staff need to have? Is it difficult to understand? I think this provides a little bit more detail. Looking at the situation of the intended target settings, so that you take all of this into consideration, that you're looking at their resources, their time, their organizational support, what incentives or regulations are in place. Looking at your research design. Sometimes, for most of you guys that were in research and evidence-based practice, when you did your methods abstract, you may have suggested a design that ultimately was not representative or even not relevant to the sample of patients, didn't fully consider the setting, and maybe didn't fully consider the sample of clinicians. You may not have evaluated cost. You really didn't evaluate the setting for adoption and assess implementation capability or implementation readiness. You may not have given much thought to how the implementation is going to be maintained while you're not there, as well as sustained after you're done and you leave. And looking at the interaction amongst the barriers in terms of the participation being low, if the intervention does not allow for flexibility, and if it's not appropriate. So again, these are the various things that you have to consider with implementation science. And this is one of the reasons why, if we revisit from last semester, even though you may have found an intervention or an innovation that would seem to work well in your patient population, you have to go back to feasibility and okay, we're not going to do that word tonight. Feasibility, and how well does that intervention apply to your setting, because you may have been able to identify various reasons and and various other factors as to why it was not a good fit. And for those, if you chose to ignore reasons why it may not have been a good fit, those would definitely come up as barriers. In my experience, I tend to see that barriers that students in particular end up dealing with, there was a clue about it somewhere. And so again, it's important to make sure that you identify those. And your SWOT analysis, that is part of the intent, so that you begin to take these things into consideration that you may not have recognized before in regards to what is feasible and what may or may not be applicable and a good fit. So again, address barriers, prioritize them, choose whatever model you're going to use for translation, and develop appropriate interventions to address the barriers. And some of that even folds into that, again, interprofessional collaboration, folds into the essentials that, or the essential that focuses on leadership, but it gives you that opportunity to assess these various elements, address these various elements, and to do so using scientific underpinnings related to implementation science, because it is indeed a science. And as we walk through the methodology section, this will become more and more apparent. And as we begin to break down collaborating and your project team and methodology, and looking at how you design and looking at your intervention and looking at how you evaluate, implementation science will trickle through all of these various elements. And it'll also trickle through as you plan and collaborate with your site, because those are some of the keys in terms of how this thing comes together and how you put it together. So we'll walk through it as you put your proposals together, and you will see implementation science surface as you plan.